My name is Terrence Monrian, and today's date is August 8, 2023. And I will be presenting today the University of New England Online Biology 1050 Cell Biology Week 14 Project Diseases of the Cell, specifically cystic fibrosis. To look at cystic fibrosis, we need to understand the cystic fibrosis transmembrane conductance regulator, which is abbreviated CFTR. This regulates the anion transport, specifically chloride, and this is involved in the hydration level of mucus and assists in clearing of airway mucus. When we look at specifically cystic fibrosis, we see that it's a mutation of the gene that encodes for CFTR. It leads to mucus retention, chronic infection, local airway inflammation, which leads to lung damage and death. Epithelial cell damage may occur, which can affect the pancreas and cause malabsorption, the liver, and deal with biliary cirrhosis, sweat glands, which can lead to heat shock, and the vas deferens, which in the male can lead to infertility. Past treatment has emphasized controlling symptoms, especially the thick mucus. This is done through physiotherapy, which is the daily airway clearance techniques, which involves pounding on the chest or the back to loosen mucus plugs and potentially improve lung function by getting rid of the mucus in the area. New therapies exist due to the discovery of the CFTR gene. The CFTR protein and genes are involved in the chloride ion transport, which leads to improved hydration of the mucus. When mucus gets dehydrated, it also increases the neutrophilic-induced inflammation, which is seen in many of the cystic fibrosis patients. Another complication of the therapies are that the CFTR modulator drug therapy is very expensive, and we'll talk about this class of drugs in a little bit. Other advances in care in cystic fibrosis involve the diagnostic methods. Newborn screening is now done. It's an early detection that leads to reduced risk and reduced cost burden. Because this is a new screening process, current young adults that may be of reproductive age are not screened. These people can be screened using blood, saliva, and cheek samples, and this will look for the 23 most common mutations of the CFTR. And these processes are extremely accurate in risk assessment when it comes to planning for children and these young adults. Cystic fibrosis is an inheritable disease. It is a recessive autosomal trait. It is not sex-linked, and it requires 2 recessive genes in order to produce the disease. So you would need 2 carrier parents with a 25% likelihood that the child would become a cystic fibrosis sufferer. With 1 carrier and 1 fertile diseased individual, there's a 50% chance of the child becoming a cystic fibrosis patient. But it's very unlikely because a person with cystic fibrosis will most likely be sterile. A carrier child occurs when 1 parent donates a trait, and again, it is not a sex-linked characteristic. Epigenetic factors are those that are not due to the DNA sequence changes. This is seen in cystic fibrosis. Proposed influencers are the histone is modified or the DNA is methylated. Lung macrophages have been seen in cystic fibrosis patients to display DNA methylation. The CFTR protein keeps the balance of the salt and water throughout the body. It is a membrane protein that functions as an anion channel. When the gene becomes mutated, the protein malfunctions, and the downstream effect is called cellular senescence. Senescence is when the cells no longer multiply. They do not die, but they continue to release anti-inflammatory agents. What happens with that is when they continue to release the release the inflammatory agents, thick mucus, sticky mucus is produced that can block the lung and the gastrointestinal tract. Pancreatic blockage can occur, which leads to digestive issues, malnutrition, poor weight gain, and a mitochondrial dysfunction may occur as an epigenetic factor, which can lead to cell cycle arrest and a greater potential for infection, inflammation, and cancer. Risk factors to avoid in cystic fibrosis is secondhand cigarette smoke. The smoke is obviously an irritant and can be very harmful to the cystic fibrosis patient who has difficulty breathing already. Alcohol use is also another risk factor to avoid. Research currently being done on the CFTR gene. It is located on the long arm of chromosome 7 in region Q31 and spans 230 kilobases, or 230,000 bases of genomic DNA, which is contained within 27 exons. The DNA proper itself is about 6.2 kilobases and involves about 1,480 amino acids. The predicted protein structure involves two membranes with domains each of 6 subunits that anchor the CFTR in the apical membrane of specialized epithelial cells. As we mentioned earlier, the epithelial cells are where most of the diseases occur and the malfunctions. It involves 2 nucleotide binding folds, or NBFs, and a regulatory domain. The mutations usually occur in the nucleotide binding folds. Commonly found at position 508 in the first nucleotide binding fold and delta F508. It is caused by the deletion of phenylalanine, the amino acid phenylalanine from the protein. As mentioned earlier, newborn screening involves early detection and reduced risks. Depending on the state that one resides in, one or more of these screening mechanisms may be done. The CFTR mutation panel, the immunoreactive trypsinogen test, and the sweat chloride test. Multiple tests are done to prevent false positives. The CFTR gene mutation panel detects most common of over 1,500 mutations on chromosome 7. This is important because the specific mutation involved in the cystic fibrosis for the patient determines the proper drug therapy. And a full list of available products and which mutations are treated with which drugs is on the Cystic Fibrosis Foundation website referenced here. The modulators are named Trikafta. It contains 3 medications. Symdeko contains 2 different medications, Orkambi, 2 medications, and Kalydeco, which is 1 medication. If you notice the different medications involved in the combination therapies, when elexacaftor, tezacaftor, or lumacaftor are involved, they actually fix flaws in the CFTR protein shape. Ivacaftor actually binds to the defective protein on the cell surface and opens the chloride channel, allowing transport of the chloride across the membrane. All of these are successful in treating cystic fibrosis, and the combination product is more successful because of the multiple mechanisms of action. The other cystic fibrosis tests that are used in addition to that one is the immunoreactive trypsinogen, which looks for elevated levels of pancreatic trypsinogen noted in newborns with cystic fibrosis. So the combination of the finding of the mutation and the trypsinogen positive, or the sweat chloride test of an elevated chloride level greater than or equal to 60 millimoles of chloride per each liter of sweat, all of these in combination make it more likely that a positive diagnosis of cystic fibrosis occurs. There is no preventative measures available for preventing cystic fibrosis from occurring. Once you have the 2 genes, the 2 recessive genes, the patient will exhibit the conditions associated with cystic fibrosis. However, improved nutritional outcomes can be seen with early interventions of high caloric, high fat, high salt, fruit and vegetables with multivitamin and mineral supplementations, and also treatments with antibiotics to treat and prevent lung infections, anti-inflammatory agents to decrease swelling in the airways, and mucus thinning agents to help cough up the mucus. Cystic fibrosis patients are known to be on multiple drug therapies and take many pills and tablets in a given day. Active research is still being done on cystic fibrosis. In fact, the current research involves a medication called 4D-710. It's looking at the safety and tolerability of the product. It's an investigational gene therapy for adults who are ineligible or intolerant to the CFTR modulator therapy. It is an adeno-associated virus administered through inhalation. Study sites are now opening and will be opening in many of the states of the United States, and participation in clinical trials involves a commitment of 11 study visits and a 2-year commitment to participation. More information is available for those who are interested in participating in the study on the Cystic Fibrosis Foundation website, again referenced here. So what is the future outlook for cystic fibrosis? Continued improvement in the management of cystic fibrosis is allowing for longer life and a better quality of life. There's promising research on the horizon with new drugs being introduced that directly deal with the genetic issue at hand. Better methods of early diagnosis are also being used and are widespread, recommended for not only newborns but those who are in reproductive age. Newer medications specific to the mutation type also allow for a greater success rate with the therapies involved and the combination therapies that are involved also. The references I used for this presentation are listed here on these 2 screens, and I'd like to thank you for listening.